Good evening, everyone, and thanks for joining me for this evening's presentation on choosing health profession schools. I'm Dr. Amanda Dye from Beyond Barnard, and I'm excited to talk to you all about kind of the principles that I think are important to keep in mind as you're building a list of health professions programs to apply to. This workshop is part of my series for prospective applicants, although if you're thinking about applying in a future year, there's no reason that you can't start thinking about these things early. So to begin, I want to talk a little bit about what my goals are for this evening. First, to think about some of the big picture and fine print factors that might influence your decisions in terms of which programs to add to your list, and maybe even ultimately, if you get multiple acceptances, which program to attend. We'll talk a little bit about how to use the information that's available to you to evaluate programs. I'm going to do that through a series of case studies. This evening, I'm going to be using medical schools because the majority of our applicants are applicants to MD programs and because the most robust information is available for those programs, but the principles at play are usable for any kind of professional program. And then finally, we'll just talk through some resources that can help you as you're learning about schools and thinking about what you want your priorities to be. So we'll do that in a pretty simple agenda, and we'll get started right now. So the first thing I want to say as we start this conversation, I want to lay out a few of what I think are really overarching principles to keep in mind about my philosophy for school selection and what I encourage applicants to think about. The first is that professional schools are more similar than they are different. What I mean by that is medical school A, B, C, D through Z are a lot more similar to each other than college A, B, C through D. This is because obviously it's important for everybody who wants to do a particular kind of job to have the same level of education. And because these programs are all offering, the same credential, essentially, they're getting you to a place to be able to practice at a particular level. They are also very tightly regulated. And that means, that things like what you would learn in dental school or medical school or a PA program is it's very tightly centrally controlled by the licensing committee. And so instead of at the undergraduate level where you could go to a small liberal arts college attached to a large research institution in the city of New York, or you could go to a large land grant university. You could go to a business school instead of a liberal arts institution. You could get an undergraduate degree in nursing instead of starting with a liberal arts background as well, right? There are so many different options at the undergraduate level that are not differentiated when we're thinking about professional programs. And so because schools are similar in many, many respects, it falls to you, the applicant, to think about subtle differences between programs to help you understand what you want to get out of your education and also what those programs may be looking for in applicants. It's also a true thing that every school out there is going to receive a lot more applications from very qualified candidates than they could possibly ever interview. This is one of the hardest things for admissions personnel because they get a lot of applications from people that they really like and would like to talk to, but simply do not have the bandwidth to do. And for your kind of understanding of the process, that cut from a completed application to an interview offer is the biggest cut in the process. Most of these programs are going to interview maybe 5 to 10% of their applicants. Ultimately, they're going to admit a much higher percentage of the people that they have interviewed. So the way you get to that process, the way that you get to, okay, I'm getting in the door for an interview and therefore having a much higher chance of being admitted to the program, is to think about what each school on your list is going to value in your application. Besides things like, having strong grades or a strong entrance exam score, what else do you expect them to be interested in? And that's what we're going to talk about today, how to think about what you are interested in, how to understand what schools are seeing and what schools are presenting to you in the form of information directed toward applicants, to understand what their priorities are, right? And ultimately, the goal of creating a list of programs is figuring out which schools' priorities align with your own priorities. So to start thinking about these factors that you could consider, your long-term career goals are a big first step, right? Are you interested in primary care, or are you interested in a career within another specialty? Do you have a particular expectation for the kind of practice that you want to do in terms of, geography, right? Are you looking to be and stay in an urban environment, or are you interested in working with medically underserved communities in rural areas? Are you interested in a career in academic medicine, right? Do you see yourself maybe being part of a teaching faculty in a medical school in the future, and working maybe at a large university hospital system? Are you interested in something like working in private practice? How much is research something that you want to have as part of your career, and how do you expect to put that together? You can also think about things like the institutional mission, right? Do you, as an applicant, share things in your personal mission that the medical school makes clear are a priority for them? So, if you're a resident of a particular area, like the downstate New York area, and your goal is to stay here and to serve communities here, there's an alignment with schools that have a similar mission, right? And that's something you can take into consideration. You can also think about the information that's available to you in terms of rates of match into residency, which for MD programs are very, very high, as well as for DO programs in the US. But you can also think about, like, are there particular patterns? If I'm interested in a residency in this particular field or in this region of the country, does it make sense to attend a particular kind of medical school or other professional program? You can think about features of the curriculum as well. Like I said, every health professions program has to teach a set of information that is very highly overlapping, but different schools may have different elective courses. You may have different experiences in terms of, like, longitudinal, maybe patient care experiences available to you at some schools versus others. Some schools still use a largely like lecture-based format. Others use much more small group and what they call problem-based learning. So it's very much, you're working together and putting your brain together with many of your peers, and very sort of seminar style education. They may have different options for preceptorship, so learning from professionals who are maybe working within the medical school community, options for things like standardized patient interaction. So does the school make it possible for you to practice some of your clinical skills before you get into a real live patient encounter? And things like sub-internships, what kinds of clinical exposure are you going to be able to have outside of your very typical internship rotations in fields, surgery, general medicine, OB-GYN, et cetera, et cetera. In terms of the educational program, you can think about, how does the teaching actually happen at this school? Is it lecture-based? If there are lectures, are they required? Are they recorded? Are they things that you can refer to later? Are there special programs or even dual degree options that might help you meet your long-term career goals? How much flexibility there is, the timing of your coursework relative to, when you're starting your clinical education, any supports or particular like time pockets that they reserve for standardized tests. I'll show you an example of what I mean by that in a few minutes. If you're looking at a newer school, understanding where it is in the accreditation process, it's important to know that in order to be fully accredited by any of the relevant accrediting bodies, a health profession school actually has to graduate a full class. So it is possible to be accepted to and to attend a school that is what we call provisionally accredited, because they do have to do a full 4 years of education before they can put people, before they can be fully accredited. So you may have newer programs as part of your list. It's something to be aware of where they are in their accreditation process, and when they might expect to be fully accredited. You can take a look at things like rates of pass on national exams. So these are the USMLE exams for medical practitioners, other exams for other kinds of professions. You, of course, might consider, how do grades work? Is it pass fail, or is it still letter graded? Now, a lot of health professions programs have transitioned to pass fail, but if they don't have that system, it's something to be aware of. So this is what I was talking about. So this is the way a curriculum could potentially be structured. This is a pretty common sort of common approach these days. So in old days, 15, 20 years ago, a lot of medical schools did 2 years of preclinical curriculum, mostly like classroom-based learning, and then 2 years of clinical education. A lot of programs have pulled that back to more like a year or a year and a half of preclinical education. And that's what the situation is here. So this is Sidney Kimmel Medical College, which is part of Thomas Jefferson University in Philadelphia. And you can see that they start their students out with what they call their Foundations of Medicine course. So you're going to go through different systems, learn normal pathology, abnormal, all of the different things. At the end of that first year, you get a little vacation. Then you come back in the second year and do some additional didactic coursework. And then you have 2 months of period for preparing for your first step of the board exams. Once you take that, then you go into your clinical clerkships and you'll do these various different rotations. And then the last phase is continuing with electives and sort of differentiating, meaning that you're starting to think about what your residency application is going to be, and you're starting to build some more academic background in the area that you're hoping to apply to. So a contrast to this is Duke's curriculum. So you can see here that actually they do their kind of Foundations of Medicine curriculum only in the first year. So from August through June, your kind of typical academic calendar, this program is kind of doing all of the basics that first year, and then immediately after the beginning of the second year, starting their students in the clinical rotations. You can also see, and this was true at Sidney Kimmel, that there are some things that kind of cross-cut the entire year, right? So the social and structural drivers of health, that's part of the curriculum that's going to continue for the entire first year. And then cultural determinants of health continues for the entire second year. Quantitative medicine and decision-making for the entire third year, right? So even though you're going to have different things happening at different points, there are going to be pieces of your curriculum that are really kind of lasting a very long time. You can also see one of the things that happens in this curriculum, because there is, a lot of time saved from the preclinical curriculum, that in year 3, there's protected time, several months for a scholarly experience. This is, a place where you would be doing a research project of some kind, and probably a lot of different possibilities in terms of the kind of work that you could be doing. There's also built into that year dedicated time to prepare for your board exams, et cetera, et cetera. As you're thinking about, the other things outside of the curriculum that you might be wondering about, considering what your hopes are for research. So if you are looking to do research as a student, looking for a professional program that builds in time for a scholarly project or a research experience is really important. You can also take a look at the school's kind of funding structure and policies for taking time off to do research. How do they support research broadly in addition to within the curriculum? For those of you who are thinking about combined clinical and PhD programs, I think the most important thing to consider here is what your research program is. You want to be able to evaluate schools based on how many faculty are working in or adjacent to the area that you want to work in. Are you applying to programs where people whom you've cited in your work are already working, right? Is there going to be a robust support from the faculty for the kind of work you want to do? You should also be thinking about how many students come into that program per year, how many of them are working on areas that are like the work that you want to do, what the training resources are, what facilities and institutions you would have access to, what the funding structure looks like. And, honestly, with all of the shakeups at the NIH, it's unclear, how MD PhD programs are going to be affected by this. There hasn't been any kind of clear information from programs disseminated as of yet. But federally funded programs, also known as medical scientist training programs, MSTPs, those are not necessarily better than programs that are funded directly by the institution. You should also kind of take a look at any curricular considerations. Are there specific aspects of the curriculum if you are an MD PhD student, and what the average time to degree is? So, I think the baseline is that you get billed about 4 years. You get an estimate of about 4 years to do the PhD, but that's an idealization, right? That's not necessarily how it works out for every person. So understanding for this particular program, what is the average time for someone to finish the PhD? For anybody, taking a look at the facilities, right? What are you going to have access to as a student? Libraries, physical and digital libraries, extracurricular facilities, are there spaces for students to use? In urban areas, it's sometimes really tough. You all know, as Barnard students, right? We don't have a huge campus, and we don't have just sort of space all over the place that we can use for meetings and things of that nature. How much of an infrastructure for things like that do students have access to at the school? Does the school offer particular technology? Will they give you a laptop, a tablet, et cetera? What kinds of clinical sites would you have access to? They're all different types of clinical settings. Would you be mostly doing rotations in the main teaching hospital? Are there options to do rotations at other institutions within the US or even outside of the US? At some institutions, it's really easy. There are a lot of connections and people can do international experiences with a minimum of disruption. At others, it's just much less common. If you are, an inveterate city person, are you looking to be in a place where you don't need to drive? If you're looking at programs where you might need to drive, do you know how? Do you have a license? And what practically could that look like for you? Student services are also really important to investigate and sometimes tough to do until you're, sort of more in the interview phase, where you can ask questions of people who are current students or faculty or staff members at an institution. But learning what you can about, like, what kind of support do they offer? Are there academic supports? Do they offer tutoring or academic counseling? Do they offer like a health center type mental health counseling? What about financial counseling? That's a huge thing, right? These programs are expensive and you probably are going to have to take on some debt as a student. So what kind of services do they make available to you to help plan what that's going to look like, especially early in your career? And what are career services like? Yes, if you go to dental school, probably you are going to work as a dentist, but what does that look like? What does applying to jobs look like? And how can the school help you with that? Also, whether these services are accessible based on your tuition and fees, or if there are, additional payments. Are there mentorship systems, either with faculty members or with older students? And who does advising? What does advising look like? How do you ensure that you make it through the program successfully? Policies are also important to be aware of. What kinds of evaluations happen? If you are at a school that uses a pass-fail curriculum, in all likelihood, they are going to have some kind of, at least a sort of high pass, not pass kind of system, at least a 3-part system for evaluating the clinical part of your education. So even if it's not directly letter grades, what does evaluation look like? Are there mechanisms for providing course reviews? What's the honor code look like? What's a process for grievances? Like I said before, the opportunity to do away rotations, domestic or abroad. How much does the medical insurance cost? Is it required? What does it cover? And policies in terms of student exposure to infectious diseases, which are, all the more important in the world, sort of COVID related that we live in now. You also want to think about who goes to this school and how well you are going to feel supported as a member of the community there. Understanding what support services or organizations there are for communities that you're a part of at that institution. Are there committees that the school has where students are represented? Things like a curriculum committee. Are there students on that committee to be able to give feedback and hopefully, make change? Are students involved in community service? Is that through student-led and kind of student-driven organizations? Is there a student government? Are there other active organizations, maybe for identity groups or professional interests, future surgeons, future primary care dentists, that sort of thing can really help you to find your people in a new school and can help you to find a real sense of belonging in the community. Location, of course, is probably the thing that comes up first. And so obviously I put it last in this list or near last. A lot of people do look to attend professional schools where they're going to be close to their support networks. I think that's fine. I think that it's quite common. But you want to think about other factors as well. When it comes to state of residence, we'll come to this a little bit later. The rules on what constitutes residency actually do differ from state to state. So you do need to take a look at the rules pertaining particularly to the state school system that you would be entering. If you are from a state that does not have a medical school, there are a lot of consortium programs or kind of agreements between medical schools to serve as the medical school for that sort of the public medical school for a state that doesn't have one. So a good example is in Washington State, there are a couple of public medical schools, but none of the surrounding states have a medical school. So Wyoming, Idaho, Montana, Alaska, none of them have a medical school. If you're a resident of one of those other states that doesn't have a school, the public schools in Washington kind of treat you like an in-state candidate, essentially. Obviously, setting, rural, urban, suburban, what's your preference there? Thinking about your geographic preferences in the long term is important, but of course, remembering that medical school is 4 years, residency is another step as well. And going to medical school in a particular site does not necessarily mean that's where you will match into a residency. Cohort size, number of students in the school overall. Is the medical school its own university? Is it close to a larger university? Is it part of like a very big system with many different graduate programs, or does it kind of more stand alone? All of those kinds of things are good to consider. And then of course, the cost. What do tuition and fees look like for public institutions? How do they differ for in-state applicants? If you are or expect to be married or have any dependents at the time you're applying, are they considered in financial aid? What does housing availability look like, particularly if you're going to a school in an urban area? Is the cost of housing factored into financial aid packaging? Are there, as I said before, resources for financial planning or learning how to budget or things like that? And is there counseling for kind of how to handle your loans as you're exiting your education? Okay, so that's a ton of different factors and a lot to consider, which I know is really, really hard to sort out in the moment. So what I want to do is try to help you understand how I apply thinking about these factors when I'm looking at the information that's available about a particular school. So I've got a bunch of case studies here. I don't know if I'll get to all of them so that we can save time for questions, but I'll get through as many as I can. As I said before, these are medical schools. The first 4 are private schools and the second 4 are public schools. I'm going to show you a little bit of data about each of them. The data that I'm going to be talking about is from the class that matriculated in fall 2023. At present, that is the most recent data that we have access to. The data for folks who matriculated in medical schools in fall 2024 is going to be available in April. Typically, that's when they do the update. So you'll have access to more updated info in a couple of months. But I will say these numbers may fluctuate a little from year to year. They're not going to be massively different next year in most cases. So Columbia gets to be first because they're the same institution as us, and this information, as I said, pertaining to the 2023 entering class. So there were over 7,200 applicants to Columbia in that academic year. They interviewed about 11% of applicants. So not a negligible number, but again, it's a really big drop, right? They're not interviewing almost 90% of the people who applied. Eventually, they matriculated a class of 138, and Columbia does not have an early decision program, so that's not a factor. They have a fairly large MD PhD program, so 14 of 138 of the students that's a lot, just to sort of norm. They didn't accept any international students. The other things you can see here, and I'll point you to the average graduate indebtedness, which is 95,578. About 90% of students receive aid there. At the bottom, you can see the numbers for MCAT score, overall GPA, and science GPA. The number in gray is the median number for people who were accepted to the institution. And then the darker band is the 75th to 25th percentile, and the lighter band is the 90th to 10th percentile. So you can see the numbers here are really high, right? The MCAT score average, median, sorry, is a 522, and the median GPAs are 3.95 and 3.96. There's a little bit of variation, right? There is a little bit of a band here, but not much of one. So these numbers are pretty important to this institution. They're not necessarily going to budge super far from this area. Things that I also know about Columbia from looking at the website, from understanding, more of these materials, is this institution does require a scholarly project, so it's a good fit for someone who is interested in a pretty research-focused program. There is a special program for folks who are interested in rural health. So even though it's an urban medical school, there is an option for a small number of students to do a special healthcare management and rural health education program. Columbia offers a bunch of dual degree programs. So in addition to the MD PhD program, which we already talked about, there's the MD and PH, lots of other kind of combined degree programs. Columbia is a really interesting institution because it's the local hospital for many of our Upper Manhattan residents in Washington Heights, but it's also an internationally renowned medical center with a lot of really cutting edge work happening there. And so there's a mix, right, of kind of being some people's primary care, and for some, it's a destination for highly specialized care. Things that I take away from the school's website, how they talk about themselves, how they talk about their students. Quote, "Our students prepare to become leaders in the practice and art of medicine." So that leadership thing is important, right? They're looking for people who have a particular kind of goal around their career. They also say the practice of medicine is a convergence of science, research, and technology, which are elevated, transformed, and given relevance by physicians through compassion, listening, and a desire to reduce suffering and promote health, right? So they're talking about the work that they do in a really holistic way, and understanding that, yes, we have to know how to apply the science, but we also have to do that in a humanistic fashion. So they're probably going to be looking for candidates who show evidence of being able to do both sides of that in their applications. Moving on quickly, next school looks really different. This is Tulane University in New Orleans. They get almost more than double the applications of Columbia, and they only interview about 4% of their applicants. That's interesting, right? They're doing a smaller number of interviews overall than Columbia does, and they're matriculating actually a larger class of 190 people. They do use early decision and early admission programs. They have a very small MD PhD program. They admitted 16 international students and interviewed 27. That's a lot. And their average graduate indebtedness is much higher than Columbia's. You can see in the metrics at the bottom, the MCAT and GPA numbers look a lot different, right? So of course the medians are lower, but the ranges are also much broader. And what you can learn from that is, okay, this is a school that gets a lot of applications. They're clearly making pretty robust decisions around whom to interview, since they're doing a relatively very small number of interviews. And the metrics are very, very broadly construed. So clearly something other than the numbers has to be important to their decision-making process. What might those things be? We look to the mission statement. We improve human health and foster healthy communities through discovery and translation of the best science into clinical practice and education. This goes hand in hand with the fact that Tulane runs 10 student-run clinics around the Gulf Coast area, not all in New Orleans, some in much more rural areas. They have a very large and well-known public health school at Tulane, and the entire institution talks a lot about its commitment to public health. It is the second oldest medical school in the Deep South. It has really, really deep roots in the region and is really focused on community-based care. They offer a rural medical education program. So again, even though it's an urban school, there are opportunities to train in more rural areas if that's an interest for students. And so for me, you know, obviously when we're looking at these metrics being so different, but we're seeing, all right, this is a school that cares about the region that it serves. It's a school that cares a ton about public health, and they really foreground community-based work. They're going to be looking for people who show those same kinds of commitments when they're making decisions. Next up, Washington University in St. Louis. This is the smallest number of applicants we've seen yet, so 5,700. They interview a lot of people, though. Almost 20% of their applicants, and they matriculate a class of 124. They don't have early decision. They have one of the biggest MD PhD programs in the country. They interview and accept a lot of international students, and their average graduate indebtedness is very low, only about $100,000, with 91% of students receiving aid. Metrics, again, are really high, right? These are pretty similar to Columbia, both in terms of where the medians are and the ranges. So, okay, we see this is a school that's focusing to some degree on the numbers, but what else helps them make these decisions, and why are they interviewing such a large percentage of their applicant pool? Keywords that you can take away from the mission statement at WashU are things like innovative, leaders, diversity, inclusion, critical thinking, creativity. They're a place that really wants to be driving conversations about what's next and what's new in medicine, and that's really important to them in the students they bring in. They are an institution that really prides itself on the low indebtedness. Years ago at this point, a few WashU students started the 500 Women in Medicine Initiative, which is a leadership development organization, really intended to uplift the number of women in medicine, not just in medical practice, but in leadership positions. So deans of medical schools or leaders within the field otherwise. Even though so many women do go to medical school these days, they are still severely underrepresented at the leadership level, especially in medical education. Research is not a requirement for WashU, but most of the people there participate in it. It has a very large MD PhD program. It's got really good mentorship programs with current students. There are tons of student organizations focused on everything from identity to professional interest to community service. And the clinical sites here really do center on St. Louis. So there's not as much of a possibility of doing away rotations, for example. Last private school is Keck School of Medicine at USC. They interview about 5% of their applicants, and they get a pretty decent number, almost 9,000. They matriculate a relatively large class of 186 people. There's no ED, but there is a small MD PhD program. No international student representation. Average graduate indebtedness around $210,000. A little bit of a lower percentage of students receiving aid, so 79%. And as you can see from the metrics, there's some wiggle room, and I would say pretty moderate in terms of medians and all of that, but still definitely defined kind of expectations in terms of the metrics. Things to know about this program. Again, I'm getting all of this from just looking at program websites. Service starts early in the first year. It's a really important component of the education there. There's a lot of emphasis on work with a very diverse patient population, so that's clearly going to be something they're looking for. Their curriculum has built in a lot of engagement with the humanities and kind of intersections between humanities and sciences. And they place a lot of emphasis on student wellness. They talk about this a lot. They are very specific about considering health from multiple angles, including financial wellness, academic wellness, social, mental, etc. All right. I'm doing okay on time, so I'm going to keep going through. So University of Connecticut is my first public institution. You can see they get over 4,000 applications. Interview about 7.6% of all of their applicants, but I'm showing you here because it's a public school, the percentages of in-state candidates as well. So about 10% of their applications come from in-state candidates. About 40% of the people they interview are in-state candidates, and about 75% of the people who actually matriculate are in-state candidates. This is a pattern that will be pretty familiar once we finish talking through these public institutions, and you'll be able to see that at each stage of the process, the percentage of in-state candidates is going to go up. There is an MD PhD program. Average graduate indebtedness is a little bit lower than national average, with about 80% of students receiving aid. And you can see here, again, these metrics are not low, but there's a little bit of variability built in there. Again, I've taken some keywords from the mission statement: innovation, discovery, education, and service. They have changed their curriculum in the past decade to really prioritize team-based learning. So a student who's really, or an applicant who's really interested in a school that that promotes learning in that kind of modality is potentially a really good fit. They're very serious about longitudinal patient care experiences. So that means typically a situation where a student is paired with a patient who has pretty regular appointments at the institution, and you kind of shadow that person, right? You're there with them as they're going through various appointments, treatments, et cetera. And this school has a really long one of those. There are mentorship opportunities, especially within the UConn community. And students are involved in a lot of clinics, including, for example, the Migrant Farm Workers Clinic that operates in Connecticut. So there are a lot of opportunities for kind of engagement with the broader community as well. Next up, our friends across the Hudson in Newark, Rutgers, New Jersey Medical School. They have about 6,000 applicants, about a quarter of whom are from New Jersey. They interview about 12% of their applicants, and 76% of the people they interview are New Jersey residents. Matriculate a class of 174, about 83% of those people being New Jersey residents. One really important thing to know about Rutgers, and JMS in particular, is that they have a very, very big early decision program. So 79 spots in their class come through either early decision, most of them are through ED. There are also a couple of BA, MD programs that they have agreements with. But that's something really important to know, right? If you're really interested in this institution, early decision is a much bigger piece of the puzzle for admissions at NJMS than it is at any of the other schools we've seen so far. MCAT numbers, GPA numbers, these are also kind of representative of clearly some variety in the applicant pool and the approach of the institution. Again, these are not low numbers, but the bands are pretty wide, right? There's a lot of variability here. It's clear that this is a program that will consider a lot of different candidates, not just a narrow set of people based only on metrics. Things to take away about this program: humanistic, culturally competent, integrity, ethical, professional, compassion. These are people who care about people. They have the oldest student-run clinic in the US. They provide extensive service opportunities in Newark. They are really, really, they really emphasize their placement in Newark, and they are very interested in folks who are motivated to work with communities like the one they serve. There's a lot of flexibility with clinical opportunities and electives, and there is a 3-year primary care MD program for folks who know that they're interested in a primary care profession. SUNY Downstate is one of our other very close by public schools. You can see almost 7,000 applicants, 35% are New Yorkers. They interview 16% of those applicants, and most of those are in-state candidates. About 86% of their class of 207 is in-state. There are spots in the class through early decision, early admission, and BA/MD programs. There are MD PhD opportunities, but it's not a huge group. And numbers, as you can see, actually not super dissimilar to NJMS. Maybe a little bit lower medians here, and maybe a slightly narrower range, but not super, super different. Keywords for downstate, things like social institutions, competent caring, advanced research strategies, and Brooklyn. This is a medical school that serves this region of New York, which is urban. There are a lot of underserved communities here. There are a lot of minoritized communities here. And so people who are interested in doing work within those kinds of communities are really attractive to a program like Downstate. They say that community engagement is a core component of their academic mission. That's really important to know, okay? If you are a person who is all about community-based medicine, this may be a place to consider, right? There is a lot of flexibility in terms of research options and funding. There are some specialized curricular pathways. So if someone is interested, for example, in medical ethics, there is a special track within the curriculum to allow you to explore that more fully. And the last one, really quickly, this is Kirk Kerkorian School of Medicine. That's at the University of Nevada, Las Vegas. It's a small medical school. It's a newer one. So they're getting a pretty small number of applicants. And you can see that the pattern is pretty consistent with the other public schools in terms of percentages of in-state candidates, although maybe the numbers are a little bit lower than others. It's a lower population state, which may have something to do with that. There's no early decision program. There's no MD PhD program. So this is not a good fit for anyone who's interested in a heavily research-oriented curriculum. It's not a good fit for international students. They do not accept, although they do accept out-of-state candidates. And you can see that, again, this is a little bit of a different pattern. There is some breadth in terms of MCAT and GPA numbers. A little bit more wiggle room with the science GPA than the overall GPA. And as you can see, the MCAT median is a little lower than some of the other schools that we have looked at so far. Why might that be? So they're looking for factors other than these metrics, and they have to do with this kind of stuff. First of all, it's the only medical school in the state of Nevada. As I said before, it's relatively new. They started admitting students in 2017. Their charge is to improve healthcare in the state of Nevada. And so clearly they're going to be looking for candidates who share that desire. They prioritize community-based learning. They have a lot of kind of not strictly just clinical things woven through the curriculum. So things like bioethics, well-being, nutrition, which are not always a huge part of a medical curriculum. And it's a school that clearly kind of really prioritizes training people for primary care specialties. So a big chunk of matches were into primary care. And about 60% of the people who graduated in 2023 were matched into residencies either in Nevada or in California, a very nearby state. And they have a set of learning communities which are intended to support students socially and academically. So they're really looking at like community development within the medical school. I know that's a big rush, but I want to kind of reflect on some of the things that we've learned and to talk a little bit about resources that you can use and ways to proceed with your own school list building as we wrap up here. So I've talked a lot about this today, right? Looking at these ranges, looking at not just what's the median or what's the average score, but how much flexibility does the school treat these numbers with based on the ranges that are available to you. I think it's always good practice to include a mix of programs. Ideally, a lot of schools where your numbers are within the range or pretty close to the average, and some maybe where your scores are relatively strong compared to what's typical for the school. As I said, using data about the range of accepted GPAs and exam scores is really, really helpful wherever you can. And it's important to know that GPA and entrance exam scores can sometimes be a limiting factor, but they alone are never going to determine acceptance, right? So within what's typical numbers wise for a school, there are always going to be a lot more candidates than interview spaces. And thinking about these other factors that I've been talking about, what each individual school is about, what they're looking for, is really important to understanding how they might view your specific application. How many schools to apply to is one of the most common questions that I get. I can tell you Barnard students and alums applied to about 23 medical schools in the past few years. National average is a little bit lower. I encourage people to keep in mind, you do have to complete secondary applications if you're applying to medical school in particular. So somewhere around 20 schools is a good ceiling for most people, I think. I find that most people lose steam for completing secondaries somewhere around that number. So keeping it to a relatively moderate length is important. As I mentioned briefly before, determining state of residency is not as simple as you might think, and the residency rules vary by state. Sometimes by school, but for the most part, it's kind of set as a state policy. So if you think you could potentially be a resident of multiple states, it's good to check school websites for public institutions in each of those states to understand, like, this is how we determine residency and kind of evaluate whether you meet those standards. It is important to know that when you submit your application, your primary application, you can only list that you're a resident of one state. That's going to show up as your primary state of residence. If you qualify technically as a resident of multiple states, you can't really encode that in the application. But if you're applying to a public school, they may ask you to provide additional documentation to further determine your residency status. So, before they charge you tuition, they're going to ask you more questions and not just kind of take for granted that you're a resident of the state. So learning kind of what the procedures are for the individual states and schools that you might be applying to is important. Resources to use as you're looking for this information. I talk a lot about the MSAR for MD applicants. This is where I've drawn all of the data from for this presentation. The subscription is not super expensive, $28 for 1 year or $38 for 2 years. If you are approved for fee assistance through the AAMC, you get a subscription of this for free. For folks who are looking at DO schools, you can use the Choose DO Explorer, which has a lot of similar information. It is free, you just have to register to use it. And for applicants to dental schools, the ADEA Official Guide to Dental Schools and the Dental School Explorer is also a subscription service, but also not super expensive at $35 a year. Other kinds of programs, health professions programs, often have a lot of online resources and guides for understanding schools, school directories, prerequisite charts, all sorts of things. So if you're looking for resources specific to a particular profession and having trouble finding them, you can always reach out to me. This is what the MSAR looks like as an example when you log in. I also encourage folks to check out financial aid resources. The AAMC, which is the MD Education Org, has, I think, the most robust online presence for financial aid, understanding financial aid. So it's a really good resource to understand a little bit about how financial aid packaging works and kind of what to expect from that part of the process. Definitely use school websites as you get into your research and want to learn more about particular programs. The U.S. News and World Report is out there, so that's the rankings of medical schools. It's a fact that it exists. It's also a fact that the U.S. News rankings are based on factors that may or may not track with your individual needs as a student. So those rankings, I don't think, should be interpreted as like objectively important in the same way to every candidate. Couple more things here. I'll share these slides so you'll have the links. Questions that people wish they had asked to kind of help, your thinking about what you might like to know about schools, a critique of the use of the U.S. News and World Report, and an example of what state residency information can look like. Reminders as you are considering schools and building your list, take notes on the programs. It's helpful to have, why you're interested in those programs for things like secondary applications. But it's also important to use those notes if you get interviews with programs and are looking to build a question list, etc. Creating a school list is always going to require you to consider your individual priorities and rank them, to think about what is most important to you. And when you're adding schools to your list, I want you to consider the question, which aspects of my application will appeal to this school in particular? You should be able to answer that question robustly for every program that's on your list, because as I've been talking about, there are going to be a lot of applicants. The school, is looking at things like metrics, but beyond the metrics, it's going to be looking for why you make sense as a student at their institution. We do have to rely a lot on online resources, especially in the early part of list building. But keep in mind that as you go through the application cycle, you're going to, learn more about programs, and ideally your assessment is going to kind of be refined over time. So what you're talking about now is making a list of programs to apply to. It's not making final decisions about programs at all, right? That will be later in the process. You will have a different set of information then. Right now, you're thinking about what is the best universe of possibilities for me to apply. And I think that it's worth it to spend a lot of time on this, because I have seen over and over again that creating a list very intentionally and effectively leads to better outcomes. Ideally, leads to a choice at the end of the process. That's what I want for everyone who applies to a professional program, to be able to have a choice at the end of the day between options that they think are really good for them. And that's it. So I'm going to stop sharing and come back. If you have questions, you can pop them in the chat. Let's see. So there is already a question in the chat, so I'm going to start there. If you have others, you can either raise your hand or add them to the chat as I'm talking here. So this is a good question. When we were looking at some of the public schools, the out-of-state acceptances are a lot lower than this person thought. What's my advice about applying to a public school as an out-of-state applicant, especially if you're interested in a particular location? It is crucial for you to understand what is typical at that specific program. So we saw a lot of programs where somewhere around like 20% or so of the matriculants were out-of-state candidates. That's actually kind of a high number. For other programs, it is really very rare. So a really good example of this is Texas. Public schools in Texas typically just do not accept out-of-state candidates in most cases. And in fact, if you are from Texas and thinking about applying to Texas schools, there's a separate application service for public medical and dental schools in Texas. So they're just a state that, the way they've set up their education system is that they're not intending to serve out-of-state applicants. There are other kinds of schools where maybe it's a public school in a relatively low population state where you'll actually see a very different pattern. So I'm Appalachian. One of the medical schools closest to where I grew up is West Virginia University. West Virginia is a very low population state. And as you may imagine, it's got a pretty low rate of people applying to medical school. So actually the majority of people at that public institution are out-of-state candidates. Now, probably it's a school that is going to evaluate whether the person has any reason to want to study medicine at their institution. Maybe the person is from a neighboring state. Maybe the person is very interested in rural medicine or some of the other programs that they have there. But what you want to do as a candidate is just be aware of what's typical at that program. I don't think it's a reasonable use of your resources to apply to a public program where you see that almost nobody from out of state is accepted. It's just, that's the school telling you our priority is in-state candidates. If you are applying to a public institution in a state that maybe you have a connection to, so let's say you grew up in a particular state and then your last year of high school, your family moved out of that state and, now your family residence is somewhere else in the country, you could still potentially apply to a public school and give them information in the secondary application about why, how you're connected to that particular state. And that can help them sometimes to make a decision. I'm very sorry if you're hearing the siren in the background. But yeah, it differs from school to school. So I think being aware, and that information is available in these guides that I've been talking about in the MSAR, they'll break it down between in-state and out-of-state candidates for every single institution. For Private schools, it doesn't matter at all. It's not a factor that they're considering in their admissions process, but for public schools, it's definitely important to be aware of the patterns for that particular institution. Any other questions?
I just wanted to ask, I know that there's a lot of coursework that we have to do throughout our time here at Barnard in order to be able to properly prepare us for applying to two different medical programs. So I wanted to ask just um which ones do you think are the most crucial for us to take? Obviously there's tons of them that we do have to take over our 4 years, but which ones do you think are like the most important to maybe like try to do as early as possible so that when we're like a senior, we're not trying to like do a bunch of credits all at once?
Sure. So I would first of all really recommend if you haven't yet come to a pre-health overview session. That's where I talk about a lot of kind of getting started with pre-health and understanding requirements of programs and kind of planning your preparation. The next pre-health overview session is next Friday, March 7th, and the one after that is on April 9th. They're both in Handshake, so please do sign up. Required courses for most MD programs and DO programs, so medical programs in the US, include 2 semesters each of biology, general or inorganic chemistry, organic chemistry, physics, all with the appropriate labs. Typically, medical schools also require 2 semesters of writing intensive coursework. And programs may not require these next few courses, but their content is on the MCAT, so it's important to take them if you do not know the course material. So biochemistry, first of all, and introductory psychology and sociology. All of those areas are tested on the MCAT. You can see more if you take a look at the resources section. So if you go to Handshake Career Center, one of the options there is a resources section. And there are a bunch of different guides there, including one really detailed pre-health coursework guide, which can be a good starting place. Any other questions?
Yeah,
Oh, go ahead, Lucy.
sorry. Just going back to the in-state residency real quick.
Yeah.
Would you mind explaining, like, if just once more, if there's any way to indicate in the secondary stage that you have like a strong connection to a particular state that you didn't say was your primary state of residency in the primary application? Like, how would that work?
Yeah. So the tricky thing is that every individual program sets their own secondary questions. So the secondary questions are by no means universal. However, it's common for public institutions to either ask specifically, more information about your residency, or to give you, a lot of schools will do this, like to have kind of a, is there anything else we should know about your application? Sort of free writing space. And that is a space where you could potentially add that kind of information as well. And
Okay.
then if you were accepted to a program where you could potentially be a resident, you're going to have to do more paperwork and things like that to kind of prove your residency before they assess, final tuition, all that sort of stuff.
I see. Okay. Thank you.
Maya, you had a question?
Yeah, sorry to anyone who's applying MD, PhD on here, but I wanted to ask, are there any other keywords that we should be looking for besides obviously research if we're trying to apply to a medical school that isn't intensely focused on research?
Well, I mean, I would say you don't want to look for what's not there. You want to look for what is there, right? So if your
Mhm.
focus is, for example, primary care, then you would want to look to see, okay, this is how this particular program talks about primary care. These are the outcomes for primary care specialties, that sort of thing. So I would say, you want to go into your school research, kind of knowing what you want to look for and assessing programs based on, what they have versus the absence. Does that make sense?
Totally got it. Thank you.
Yeah, absolutely. All right, well, we're a little bit after 7 as it is, so I'll let you all go. I hope that everyone has a great rest of your evening, and please do let me know as you have additional questions. I'll be doing more workshops later in the spring, so keep an eye out for emails from me, and have a great evening, everyone. Thanks.
Thank you.